Dr. Sumita Muthu. Next present.
A very good afternoon, everyone. I'm going to be presenting about how endo illuminator is used in pediatric cataract surgery as a guiding light, especially for beginners or novice surgeons in a dark tunnel as in pediatric cataract surgery. So these are my co-authors and we have no financial disclosures to make. So we know that pediatric cataract surgery poses several challenges. An appropriate anterior capsular rhexis becomes a challenge, especially because of the elastic capsule and the need to use a rhexis forceps, which residents are not used to. A good posterior capsulotomy is required for this. A good visualization of the posterior capsule is essential. And adequate anterior vitrectomy is required. Again, visualizing the transparent strands becomes a challenge here. So proper visualization becomes utmost essential in completing each of these steps. So would the illumination of a microscope suffice, or would an enhancement of illumination, for example with the endo light, improve the surgical technique or outcome is what we wanted to see. So our objective was to compare the visualization of posterior capsule during posterior capsular rhexis using direct microscope illumination, and also to compare the visualization of the vitreous. So 20 children who underwent cataract surgery with anterior vitrectomy and capsulotomy by a beginner or a novice surgeon by conventional technique under the microscope light, and then later confirmed by an expert surgeon. So only non-complicated cataracts were included in this study. So first, the pediatric cataract surgery was done by conventional technique initially, that is using just the microscope light. If there was good visualization, the surgery was completed by this technique, and this was assessed at every step by an expert surgeon. Then endo illuminator was used whenever there was a poor visualization of structures, and then the endo light was used to complete the rest of the surgery. Again, each of these steps were assessed by expert surgeon. So here is an example of how the nick in the posterior capsule is partially visible under the microscope light, but becomes very clearly visible with the endo illuminator. So like this, at every step, if there is difficulty in visualizing the structure, the novice surgeon was not allowed to proceed without proper visualization. So we assessed for the completeness of anterior vitrectomy. This was done by the expert surgeon, and the posterior capsulotomy was again assessed for the size, centration, and for regularity. So what we found was, with the conventional technique, the beginners could complete the surgery in 15% of the cases, whereas endo light was required in almost 85% of the cases for one or the other steps. So let's look at what steps these are. So to visualize the PC nick, it was required in about 5 cases. It was required in vitrectomy to visualize the transparent vitreous strands, and in one case it was required to complete the anterior capsulotomy because the dye was washed out. It's not moving. The slide is not moving.
Can you help us? The slides are not moving.
Yeah, okay. So endo illuminator therefore is an inexpensive tool which helps in proper visualization of the structure and makes each of these difficult steps a little easier for a novice surgeon. So therefore it is a boon for residents and budding surgeons, and acts as a guiding light in a dark tunnel. Thank you.
Thank you.
I have few questions.
Yes.
The first, there are endo illuminators with focused light source or a diffuse light source.
Yes, sir.
Which
So
one
we
did
use
you
the
use?
focused light source.
The focused one.
And it is used externally. It is not inserted into the anterior chamber. It is used externally.
I know that. And who holds the endo illuminator? Who holds the endo illuminator? The doctor? Or
the assistant.
The assistant.
The assistant. Sometimes when you are not performing the surgical step, the surgeon himself holds, like you want to just visualize, confirm if the vitrectomy is complete or confirm the margins of the rhexis, then the surgeon themselves hold it. If not, the assistant holds it. Suppose it is required to complete the anterior vitrectomy and as the surgery is being done, then the assistant holds the endolite. Of course, it requires a little learning curve as well.
Can it not be like an attachment to the microscope? I mean, some would come with the retro, but
yes,
if it is, then your hands are free. You know what I mean?
that is true, ma'am. But unfortunately, depending on the pupil size and everything, the distance at which the endolite has to be held varies a lot. So I don't know if we can come up with
The
anything like
best
that.
view the surgeon gets with once he or she holds
Holds
the endo
it.
illuminator.
Yes, I agree, sir.
Or else the
Assistant,
hereditary,
yeah, it does require a
the
learning
retro
curve.
is the best otherwise.
Yes.